It's now been 4 years since the first case of COVID-19 was confirmed here in Michigan. And wow, how things have changed since then, right?
It's amazing that it's been 4 years because it's so vivid in our thoughts and memories. And while COVID is no longer at the front of everyone's mind, it's not going away anytime soon. You probably know people that have recently had it. Right now, it's not our biggest health concern, though, as a state or as a country, for that matter.
Well, we want to talk about this in depth this morning, and joining us to do that is the state Michigan's chief medical executive when it comes to health and all things like that, Dr. Natasha Bagdasarian. Great to see you again. Thanks for joining us. Let's start right there. From your view, how much of a threat is COVID today in 2024, considering we saw the CDC just rolling back some isolation windows?
Well, COVID, of course, is still around. It's still a threat. It's still putting people in the hospital, and people are unfortunately still dying of COVID-19. Now, we have to keep in mind that COVID isn't going anywhere, but the situation is very different than it was 4 years ago because we have immunity. About 98% of the U.S. population have some level of COVID-19 immunity, whether it's from a previous vaccination or a previous infection. And so given that landscape, we're in a different position today than we were definitely 4 years ago.
What about vaccinations? Are there still recommendations for certain populations to get the latest vaccine, and at what frequency?
Well, COVID-19 is really turning into a disease that we're expecting to see coming back around annually, causing those surges during the winter months. It's possible there could be some surges at other times of year, but to really protect people against those wintertime surges, there will likely be a new COVID vaccine every fall. So the same type of cadence that we see with influenza vaccine. Now, most people will expect to get one single dose of vaccine every year, but there are some certain populations, including those who are immunocompromised and those who are over the age of 65, who may qualify for 2 doses of the vaccine.
Oh boy, 98% immunity really is encouraging. Speaking of disease with high immunity, measles is something we probably never thought we'd have to discuss in great length anymore, but here we are with more cases popping up. What is your take on these recent cases, and is that going to force a lot of people back to improving upon the health of getting those vaccines?
Well, we're really hoping that people are hearing the message to get vaccinated. We've had 3 cases of measles in our state so far, but there's a resurgence of measles globally, and we're seeing outbreaks across the United States. There have been outbreaks in multiple states now, 16 in total, just in 2024 alone. And so we're really urging people to take a look at those vaccination records and see if they are up to date with their measles vaccination. Measles is something that we shouldn't have to think about because the vaccine is so incredibly safe and effective. And if you get vaccinated, it is around 97% protective against the disease.
Do you think this is kind of a fallout from the fight over vaccinations with COVID? People started letting this lax a little bit?
There was a lot of misinformation and disinformation about vaccines during the COVID-19 pandemic, and I think that has impacted us. I'm also hopeful that there were some people who simply let their vaccination status lapse during the pandemic when they weren't going to see their healthcare provider in person. And so again, for those people who may have just let things lapse, this is a really good time to make sure that you and your family are protected.
And so getting back to COVID, there are many people that are suffering from long COVID. Have there been some advancements in the treatment, the understanding, the prevention as it relates to that?
Well, long COVID, we have to understand this disease has only been around for 4 years. So the very longest case, it was someone who contracted COVID just 4 years ago. We still need more time to understand what the long-term effects look like. And there are lots of national studies happening around our state, but we still need to develop that understanding of what exactly is happening in the body.
I know it's kind of behind us, but what is your take on if history repeats itself? I mean, are we ready for another pandemic should something come our way again?
There's a lot of work to do. We have to know that pandemics are things that happen. This is a cyclical thing that happens every few hundred years, every 100 years or so. And so we have to be prepared for the next one to potentially happen sooner with some of the changes we're seeing in our climate. And that means doing things like funding public health and also making sure that we've got connections with healthcare, that people trust their doctor, that they trust public health, and that they're heeding those public health recommendations.
Well, we appreciate you joining us, Dr. Bagdasarian. We appreciate the perspective and kind of letting us know where we are here in the state and the country.
Thanks for having me on.
Yeah.